Good evening, sir.
Hi, good evening, everybody. Am I
Sir, you're
audible?
on mute.
Am I audible? Am I audible?
Yes, sir.
Okay, so let me share my screen. Just hold on. There are some issue from here. Can you send any email to me? I just sending my slide so that you can share from your site. I just
Okay,
will
sir.
send that. Yeah,
Sir, could you tell me your email ID?
yeah. It is dr.sanchan2012 at gmail.com. I'm just typing to Rupal. She will
Okay, sir.
okay, Rupal, I'm sending to you. Just ping me here. I've just sent you. You can see my screen now.
Yes, sir.
Okay, let's start.
Sir, so start you can begin now.
You can see my screen now.
Yes, sir. Yes.
A very good morning to one and all present here. I, Tasvi, on behalf of the Interact Club of Amity International School, Sector 43, Gurgaon, Ruhaniyat 4.0, welcome you all to this webinar on cervical cancer awareness. We are honored to have amidst us Dr. Sanchan, who is a medical oncologist with 15 years of experience in handling critical and complicated cancer patients. He is well versed in administering chemotherapy, immunotherapy, targeted therapy, and management of their toxicities. He also actively participates in genetic screening, genetic counseling, and interventions in high risk patients with strong family history of cancer. Handing over to you, sir.
Yeah, hi everybody. Thanks to Rupal for connecting all of us, and I am very honored to give me this opportunity to present in front of all of you. So basically, basically I am senior medical oncologist. I am practicing my career. I have been 8 years in Delhi, and I was in Sector 47 Gurgaon near to you. I have just moved here in last year. So basically, I have seen that in India, I have been USA also. So what I have felt in difference to India and Western practice of medicine, that the awareness is very lack in India, especially see our most of us are actually are around 45 to 50% per people who live actually below the poverty line. They don't have that much knowledge or awareness about this cancer. Now see, the prevalence of cancer is actually increasing in incidence, mortality rate, everything is increasing, and the data are actually showing the in near future, like in down the line 10 years, this cancer will be an epidemic. So we have to be alert, and we have to basically be proactive to create the awareness among the all families, friends, common people, so that they get correct right way, what is the early symptoms, what are the early signs, so that they can come to us very early, so that we can diagnose the cancer at very early stage and we can cure the disease. So today I have kept this topic because this cervical cancer is very common in our India, and you know it is posted just second after the breast cancer. And what is the beauty of this cervical cancer? That cervical cancer is a preventable disease. So you can imagine the cancer that is preventable just giving 3 doses of vaccine. So that's why my motto is to aware all of you, and through you all your friends and family, so that they can get a awareness about this important topic, that is the cervical cancer. So let's move on. So first you can see my screen, na?
So your screen is stuck on Google Meet.
You can see.
Yes, sir, your screen is visible.
Visible, no? You can see my presentation.
No, sir.
Can you send me this? I'm just forwarding my PPT. Rupal, can you send me your email
Sure.
this year?
Yes, sir. Sure.
Yeah, you can check the email. Yeah, just get the full screen. Yeah, yeah. Now you all see the PPT. Yeah. Next slide. Yes. You can all see this.
Yes, sir.
Okay. So this is actually the global prevalence of cervical cancer. Basically, cervical cancer is the fourth most common cause of cancer among the female population globally. And we can see the from 2020 to 2040, how is the predictive expecting the raise increase in the mortality rate or death or the new cases or incidence worldwide. Next slide. So you can see what is the contribution of our India. India basically contribute one fifth of the global cervical cancer burden. So it is the huge burden in India. Next slide. So in India, prevalence wise, cervical cancer is the second most common cause among the female population after breast cancer. You can see on the right hand side, you will see the percentage. And cervical cancer, and it is the most common cause of cervical cancer is just a virus. The name of the virus is human papilloma virus. You can read in your biology book. So next slide, please. So in India, it accounts for nearly one fourth of the world's cervical cancer death. So it is the very high mortality. And according to the HPV fact sheet 2017, in Indian every 8 minutes, one Indian woman die due to the cervical cancer. So the high mortality rate is around 60%. It is called cancer related mortality rate. Next slide, please. So you can see basically the cervical cancer, basically when our patient present to our OPD, the most common age of the presenting female is between 35 to 44. So it is the productive age of the most productive age of the female population when the present. Average is around 50. So you can see the younger population is affected by the cervical cancer just below the 50 years of the life. As a whole, if you can consider the risk factors of the cancer, we can say that age is the very important idiopathic or non-modifiable risk factor of cancer. And most of the cancerous population we can see basically after 50. But here you see the cervical cancer, the most prominent or the prevalent population is younger age, young female, and their age is like 35 to 44. So they actually comes along their reproductive life, the most important reproductive life of their life. Next slide. So you can see, suppose one patient came and they have diagnosed with the cervical cancer. Now, as this patient has a very young age, you can think that there is some psychological impact on the patient part. Why? Because the diagnosis of this cervical cancer, even suppose you go to a doctor's clinic or gynecologist, suppose they have done some routine pap smear test for the female, and this pap smear suppose came to be positive or abnormal, and definitely this is actually agony, and the patient feel many things came to their mind. Women may receive an abnormal pap test, may have experienced feeling of shock. What is happening to me? Fear of treatment. What can be the treatment? What can I do? Why will I develop cervical cancer? So many questions actually roaming in her head. Now, concerning regarding the reproduction, sexual function, body image, self-esteem, what the people will say if they know about my diagnosis or my this test, positive test, what they will think, what society will think. So many things they will think at sitting at the doctor's chambers. Now, having to undergo treatment is very important hurdle for her if she diagnosed with the cervical cancer, such as suppose we explain her that she need surgery, radiotherapy, chemotherapy or systemic therapy. Definitely that will increase the agony and the anxiety or the depression. sometimes frustration, anger among herself. So because the age is very young, that's why this psychological impact is very strong among the young population. Next slide please. So I have to give the overview of cervical cancers. Next slide. So suppose, as I told, that it is the most common cause is human papillomavirus, and it is the 99% cases this is the most common cause. Next slide. So we can aware the people what are the most common risk factors for cervical cancer, and these patients actually have more prone to develop the cervical cancer. Number one is smoking, because we have seen because our in past life, along with the male student population, we have seen in the college goers, even the school goers, they have actually smoked. So smoking increase this cervical cancer 2 times compared to the women who don't smoke. Age at the first parity, that sexual intercourse less than 18 years increase with twofold increase. So that's why the population of the village population who actually get their girls married under the age of 18, so young age of marriage before maturation, less than 18 years, increase this first sexual behavior before the 18 years, definitely increase the chance if they get married after 21 years. Multiple pregnancies, suppose patients have the multiple pregnancies, they are also increased risk. Immunocompromised states, suppose the patient has the sexually transmitted disease or HIV, AIDS, or other immunocompromised therapy she is receiving, like suppose patient is on steroid therapies or a patient has any arthritis, for that reason she is receiving any other form of therapy. These immunocompromised states definitely add to the risk factors of the cervical cancer. Next, there are also 1.9 or 2% twofold increase in the have the increase in oral contraceptive pills. Those patients who are taking the OCPs, they also have this chance of increasing cervical cancer. And those who have the cervical intraepithelial neoplasia, this is the pre-malignant condition of the cervical cancer. See, there are some cancer who actually develop from a pre-malignant condition. Suppose there are some epithelial changes, some normal epithelial to dysplastic epithelial to cancerous epithelial. You can see the cell division in your biology book. So you can see when the patients present in the pre-cancerous lesion like cervical intraepithelial neoplasia, this is the most common pre-cancerous lesion. They have the 3 times risk for development of the cervical cancer. Next slide please. So what are the clinical presentation of cervical cancer? Suppose one patient have this kind of symptoms, definitely our suggestion, they don't ignore this type of presentation. What is this? Suppose the patient present in early stage of cervical cancer. So what symptoms they have? So they have the symptoms of irregular heavy vaginal bleeding. They have the mainly the postpartum bleeding, non-specific vaginal discharge that are watery, mucoid, purulent or malodorous like foul smelling discharge per vaginally. Or suppose the patient has a advanced form of the cervical cancer who actually ignore these symptoms. Suppose these symptoms happened 3 to 4 months ago, and suppose the patients belong to the village, they don't have that much medicine facility or the awareness, they actually ignore. Now after 5 to 6 months, they have the added symptoms with this, like pelvic pain, like back pain the patient may present, or bowel bladder changes, any pressure problem, hematuria like urine bleeding in the urine, hematochezia like any bleeding in the rectum or the stool, and also vaginal passage of the feces, because there in advanced stages what happens, there is a breach of the epithelium and there is a connection between the because you know, if you can see the biology, the when the anatomically when the where the cervix present, in front it is the present our urinary bladder, and back of the cervix it is present the rectum. So when the patient present with the advanced stage, there is a communication between the rectum and the urinary bladder. So patient may present with the parvaginal passage of the urine or parvaginal patient of the stools. So these are the presentation from the advanced stage of cancer. Next slide please. So what are the diagnosis stage? So suppose the patient came to us in the very early stage, or patient came to us very advanced stage. Now what I should do? We should do the abnormal pap smear. We can do the simple pap smear. If the it is a non-visible lesion, we can go for cone biopsy, or there is a some special biopsy called endocervical curettage. We also do some imaging. We will do some serology test whether the patient is immunocompromised, or patient may have the hepatitis screening, or rapid plasma rigging test. If it is visible lesion, we definitely get our gynecologist friends to do some biopsy from their growth. Physical examination, complete blood examination, cervical biopsy and imaging, and also the HIV testing or serology testing. Colposcopy is a special form of the test when we give the abnormal pap smear. Suppose in routine examination we did our pap smear and it came to be abnormal. Next we'll refer the patients to our gynecologist friend who will do the colposcopy to confirm it. And if the patient that came to be positive, then we have to stratify the patient, or we have to see whether this patient we have to stage the patient. So we'll do the further imaging like PET CT scan. This is the most modern form of the therapy, or we go for the MRI, or we go for the CT scan to see how where the disease is actually present. Because when the patient present to us, we will assess the patient whether this disease, whether it is detected, whether it is localized or it is metastatic. Localized means when the disease is limited to the disease primary site. Suppose the tumor arises from the cervix and it is present within the cervix, or suppose it is just touching the in front bladder or back the rectum. That is called locally advanced stage. And the suppose sometimes patient ignore the symptoms and patient present with the more advanced stage, like patient when we did the imaging like PET CT scan or CT scan, suppose this patient has deposit some seeding of the tumor in the liver, or some patient present with the cough or coughing of the blood, like we call it hemoptysis in our medical term. Suppose then we did the imaging and we see some spots in their lungs. So we have to doubt that whether this disease has metastasized to the lungs or liver, that we have to exclude by doing this imaging. So this is the basic test we will do or assess how when the patient present to us. Next slide please. So this is the actually the key WHO global cervical cancer elimination. They have target by the year 2030. So what they have targeted? They have targeted 90% vaccination of the girls by the age of 15 with the HPV vaccine. 70% screening. Now WHO actually in imposing more screening, more awareness, so that the 70% of the women population get at least this screening test by the age of 35, again at the by the age of the 45. And when they have diagnosed either with proper cancer or precancerous lesion, as I already told, so 90% of the women with the precancerous must be treated and definitely seek the medical advice from us. Next slide. So prevention of cervical cancer. First, avoidance of HPV infection. How we will do it? You have to do it by HPV infection by abstaining from the sexual activity, or practice the safe sexual practice like mutual monogamy or use of the protections. And suppose they have to undergo also the HPV vaccination. That time repeatedly telling HPV vaccination, I can elaborate a little bit, because last year when I was in Gurgaon, the Merck has been deployed this vaccine, Gardasil 9 vaccine. Previously there are some other vaccine like Cervarix and Gardasil normal vaccine, where these vaccine are active against only the 4 serotypes, where the Gardasil 9 vaccine, they are actually active against the 9 serotype of this human papillomavirus. So they actually, by giving this vaccine HPV Gardasil 9 vaccine, they actually protect against the 9 serotype of HPV virus. Those are actually more prone to cause this cervical cancer. So HPV vaccine is very important, not for the prevention of the cancer development, also it helps to prevent the genital warts. So genital warts is also a little bit pertaining to the cause the and also support the development of the precancerous lesion. And routine screening using the pap smear, that is a very simple test. A woman starting from the 21st years to 65 years, that help to prevent the cervical cancer. Next slide. So cervical cancer screening practice in India, you can see the graph that it's starting from the 18 to 30 or 30 to 39. There are very low percentage of population. So cervical cancer screening rates in India is only 3.1% among the female population starting from the 25 to 64 years, and it is the data of 2003. Next slide please. So why the need of the cervical cancer screening program? Because cervical cancer is often identified as the late stage in India due to the lack of awareness of poor screening. And in Tata Memorial Hospital in Mumbai, they have actually conducted the study, retrospective study from 2006 to 2008. What they have found? They have found that cervical survival rates decrease with the more advanced stage of diagnosis, and early detection help to improve the cervical rate of the cervical cancer. So if we get proper screening, if we add the people, we can detect the basically disease at very early stage. And with the early stage in the cervical cancer, if we do the curative treatment, the survival is very long. Suppose one cervical cancer patient presented in stage 1, stage 2 stage, because you know in cancer there are multiple stage, 4 stage mainly, 1 2 3 4. So stage 1 stage 2 roughly is early stage, stage 3 is locally advanced, as stage 4 is the last stage. This is the gross for all cancer. Now if we consider the patient presented with only stage 1 and stage 2, and if we can cure with the we can treat the patient with the curative intent, so we can increase the survival of the patient, and suppose the patient may live for next 20 years. So this is very important for us to get this screening program attached and get the awareness and get them screened at very early stage of the disease. Next slide. So HPV vaccination, regular cervical screening are effective way to prevent the cervical cancer. As I told, there is more than 95% are caused by this HPV virus. Next slide. So these are actually the HPV vaccine that I already told, Gardasil 9 vaccine. This is the 9 serotype they actually active, but the most ferocious virus serotype is 16 and 18. These 16 and 18 actually not only cause the cervical cancer, this HPV vaccine actually cause oropharyngeal cancer in both male and female population. They are responsible for the anal cancer, rectal cancer, some parts. So these 16 18 is actually notorious. And according apart from this, there are 6 11 16 18 31 33 45 52 and 58. So what is the special features of this Gardasil 9 vaccine? Because in this the previous vaccine, Cervarix and the Gardasil normal 4 serotype vaccine, they actually indicated only for the female population 9 to 26 years. Now they have increased the age from 9 to 45 years. So they are telling at least if you miss the 26 years of age, both male and female, in previous 2 vaccines, these male population are not included. And this Gardasil 9, now they have included 9 to 45 years, both male and female population should get this vaccine. There is only 3 doses, 0, 2 and 6 months. So you can visit your doctors and get this vaccine. Next slide. So method of cervical cancer screening, this is the visual inspection. We can do the pap smear testing. We can go for HPV DNA testing to see the viral load in the blood if it is positive for HPV virus. Next slide please. So this is the overall gross age-based screening guideline for cervical cancer. Suppose the patient is less than 21 years, no screening is recommended by either guideline. If the patient is suppose 21 to 29 years, so we have to advise the patient get this cytology pap smear at every 3 years. or if the patient is high risk HPV, then testing to be done every 3 years if the patient is more than 25 years. Suppose the patient now enter into the 30 to 65 years. Now we have to do the cytology along every 3 years, or we according to the NCC and what I prefer American guideline above 30 years, they actually include both pap smear and HPV testing. They are both combination of this. And more than 65 years, no screening is recommended if there is 3 negative screening are found before that. So next slide please. So now suppose patients comes with the cervical cancer diagnosis. So what are the gross treatment we can know? The gross treatments are like these are the basically the 3 pillars of cancer treatment: surgery, radiation, and systemic therapy that I actually give: chemotherapy, immunotherapy, targeted therapy. Next slide please. So what are the newer developing cervical cancer therapies? Next slide. Now see, with the development with the science, our medical oncology field also advanced. Now suppose down the line, suppose before the 10 years, we have only the option for chemotherapy, that is the mainly systemic therapy. Now we have that immunotherapy and targeted therapy. So with this, applying this immunotherapy and targeted therapy, this is the most advanced form of the medical oncologies. Even when the patient present in cervical cancer in very advanced stage, suppose in stage 4, we actually have seen a very good response, maintaining the quality of life and increase the survival of the patient. So this is very important. So just to avoid you, what is the targeted therapy? Target, you can know that we have some sort of point that we have targeting. So when the tumor grows inside our body, they actually express some specific target. So suppose patients came to us, we did a biopsy or histology of the tumor. Then we can see what are the target present among the tumor tissues. So according to the expression of this targeted mutations or targeted link in the tumor cells, we actually decide what type of targeted therapy we can give. What is the special features of targeted therapy? As you know, chemotherapy means it is a systemic therapy. It actually cytotoxicity. It will kill both the tumor cells and also the normal cells. So toxicity are more those who are receiving the chemotherapy. Whereas targeted therapy, this targeted therapy also introduced by the intravenous cannulation, and they actually target only the tumor cells who are actually expressing the targeted links. Next slide. And this is the immune checkpoint inhibitor. This is also immunotherapy. This is the most modern therapy. In my YouTube channel, though it is in Bengali, I have actually told in details about this targeted therapy, immunotherapy, chemotherapy. Many educational video I usually regularly upload in my YouTube channel to aware the patient, to create the awareness among the people. So if you can watch also this and know how is the mechanism of action, what is the difference between the systemic therapy, what I administer regularly in an OPD. So immunotherapy act by augmenting your immune system. So suppose patient cancer cell actually attacking your body. Now they actually go undergo some escape phenomena. So you can see read in your biology book, there are some cells called T cell. They actually identify the foreign body that enters in your body and kill them. Now what are the basic features of this cancer cell? When the cancer cell grow, actually they escape of this type of detection by this T cell, and they grow enormously to go undergo the malignant proliferation. This specific type of therapy, that is called immunotherapy, they actually they regain these T cells to detect the cancer cells and kill them instantly. So this is the type of the immunotherapy that you are using regular day-to-day practice, and we also get a very good benefit by administering this. Next slide please. So what is our takeaway home message? Number 1 is India is the major contributor of global cervical cancer case. So one Indian woman dies due to cervical cancer in every 8 minutes. So it's a very high mortality rate. Combining of the cervical cancer screening twice per lifetime along with the vaccination, that can eliminate the cervical cancer, right? So that is very important. You can see how is the mortality rate, and we just can eliminate the this type of notorious cancer by giving this vaccine only. And 2020 2030 actually WHO called the elimination of cervical cancer by 2030 by vaccination, screening and precancerous lesion treatment. NCCN, the American guideline, basically recommend the three pillars of cancer therapy, and there are some targeted therapy or immunotherapy. There is a recent modification that actually add to the survival of the patient if the patient even present with the advanced stage or stage 4 cancer in cervix. Next slide, please. So thank you very much for your patient hearing. So if you have any doubt, you can reach me on WhatsApp or email. I will definitely help you. Now, question session, please.
Yes, sir. So, those who have their questions can raise their hands and Tashri can moderate. Tashri, just call the names of the people who are raising their hands.
Riva. I just wanted to ask, if someone is pregnant, are there any special things that
No, I cannot hear.
consider when it comes to cervical cancer?
I cannot hear you.
Riva, repeat your question. 1 second, I'll just ask from a different device. We'll move on. Iha. Yes. Hello, am I audible?
Yes,
Yeah,
yes.
yeah. So, can you please provide information on the latest advancements in cervical cancer research and cure?
As I already discussed, the recent advancement is the targeted therapy and immunotherapy that I already told you. That targeted therapy actually target the specific target when the tumor tissue is growing. There are some special targeted population actually generated in the tumor, and our science is so much advanced. They actually specifically detect this type of target which cells are producing and specifically kill only those cells and saving the normal tissue. So, an immunotherapy, I told what is the mechanism of immunotherapy, how it actually acts. So, this targeted therapy and immunotherapy actually better compliant than the chemotherapy, because chemotherapy is adds a systemic therapy. It is a cytotoxic agent. It kills both the tumor cells and the normal cells. So, side effects are more with the chemotherapy, but less with the targeted therapy, immunotherapy.
Okay, sir. Thank you.
Welcome.
Jia.
Yeah, so what kind of tests do we need to do before we can decide on treatment?
See, as I told, for screening purpose, the American NCCN guideline recommend the Pap smear screening, and if the age is more than 25, they actually add the HPV screening also along with this. And they are telling that combination of these two is very important for the screening purpose. And for diagnosis purpose, as I told, if the lesion is visible, then we take the normal biopsy, the OPD procedure from our gynec-oncologist friend. And definitely after when this patient came to positive, then definitely we will go for next imaging study. Where is the location of the tumor, whether it is localized or advanced, as I discussed or told you previously.
Okay, we'll move on to the next question. Pulkit Nagpal.
Sir, what is cervical cancer?
Cervical cancer is cancer means the malignant population. Suppose one cell is dividing. Suppose one cell is dividing into two by mitosis. By suppose and another two is dividing to four, like this. Now, when there is some signal, like suppose there is a malfunction of the DNA repair, okay, and from this they got the abnormal signal continuously. That is, then there is a much proliferation of the cells, and the normal cell cycle has been disrupted, and they are getting the malignant proliferation. Then multiple, like instead of 2 they are producing 6, instead of 4 they are producing 10. So this is called malignancy. So, and this cervical cancer, this type of malignant, this abnormal population of cell, when there is a happen in the our anatomical position cervix, that is called cervical malignancy.
Okay, we'll move on to the next question. Riva.
Yeah, I wanted to ask, if someone is pregnant, are there any special treatments that doctors need to consider?
Yeah, very good question. See, suppose there are in pregnancy, the most common cancer diagnosis is the breast cancer. Okay, There are very less, other cancer are very less, but we have definitely found some cancer pregnant patients come with this cervical cancer. Now, see, if there are, we have to discuss with our gyneco-oncologist friend whether this pregnancy to be continued or can be terminated. Suppose this pregnancy is before 20 weeks of the pregnancy, and there is a option for termination of pregnancy, or the patient continues, then you have to terminate the pregnancy. If the suppose diagnosis in the second trimester, suppose more than 20 weeks, then we have to continue the depending on the burden of the disease, we have to continue the pregnancy. And in pregnancy, radiation therapy or chemotherapy is actually contraindicated. And if we think that within the delivery period we can do the minimal surgery, we can just go for localized surgery, and definitely we can progress, allow the pregnancy to continue, and after delivery we can go for definitive rest of the radiotherapy or chemotherapy or systemic therapy, like that.
Okay, thank you, sir.
Ashmi Kathuria.
Sir, my question is, what is the connection between hormones like estrogen and progesterone and the risk of cervical cancer?
See, Ashmi, basically cervical cancer, I told, mainly caused by mainly virus. Okay. See, as you told, the estrogen hormone. If we consider the breast cancer, this is the number one cause in our country. This proliferation of the breast malignant tissues is actually caused by this hormone, estrogen hormone. So in that case, we have to see the hormone expression in the breast cancer. But in cervical cancer, our main importance is to stop the prevention of this HPV virus. So there is less chance for the hormonal manipulation of this cervical cancer development.
Thank you, sir.
Welcome.
Ahana.
Yes, sir. I wanted to ask, how will the treatment of cervical cancer affect the patient's daily life?
Well, very good. See, suppose patient has underwent surgery. So definitely, when the patient diagnosed in the precancerous lesion, suppose this lesion is very small, you can, in your biology book you can see the basement membrane. So suppose the cancer limited to the basement membrane, then we can call the cervical intraepithelial neoplasia. This is called the precancerous lesion. If the this tumor breach the basement membrane, come outside, then we call it invasive cancer. So suppose patient is in did not breach the basement membrane, so they are actually in the in situ carcinoma, precancerous lesion. Then definitely we have the option for the colposcopy. We can remove the whole tumor, and patient can get cured. Or suppose patient present in the very early stage, we can get the removal the whole by this doing the surgery, and surgery will be limited. But if the patient ignores the early sign that I already told, and patient present in the advanced stage, and definitely they actually got hold, suppose urinary bladder or suppose rectum, then definitely there will be the major surgery. So definitely there is a stress of the surgery, and they have to bear about this. Their surgical colleague of us definitely guide the patient how to maintain the daily diet. During systemic therapy, on my part, chemotherapy or immunotherapy or targeted therapy, I actually, yes, stress on the supportive care on the day one while treating the patient, because palliative care or supportive care is very important while maintaining the body weight of the patient, because due to the stress, due to the mental agony, due to the treatment stress, and it's a long term treatment, not just a 7 day course of antibiotic therapy, like you got any chest infection, you got any antibiotic and get removed from your body. It is a long process, right? So during this maintaining of well-being, maintaining the weight, and patient should also motivate herself regarding the meditation program, regarding the yoga, so that he just she or she actually keep herself busy in the day-to-day life. So that is very important of the therapy.
Thank you so much, sir.
Vansh Narula, you may ask your question.
Hi sir, I'm Vansh this side. Actually, I had a question that cancer and surgeries could affect a person's daily life in a worse manner. We have discussed it already. But what about the mental stress and the mental pressure that the patient goes on with in their lives while in the surgery and outside the surgery too? And like how they could recover from it, and also as you talked about targeted therapy and normal and chemotherapy.
Immunotherapy.
In the targeted therapy in India and in the most of the countries, targeted therapy is much costlier and much more like less practice than the chemotherapy. And chemotherapy is very cheap for what it is. And we already know that chemotherapy has so many side effects and all. So why is there um, so much of difference between the payments and all? Like, could you explain that, please?
Yeah. Once very good question. First, come to a first question that see every therapy we can call is like Newton's third law. Every action has an opposite and equal reaction. Like that, those therapy who has the effect, definitely you have to beat the side effect also. So suppose in my case, if I administer the patient like chemotherapy, targeted therapy, immunotherapy, first important is the counseling of the patient. Not only the patient is also relative, because cancer therapy is not directed to a patient, because it bears the load on the family also. So you have to take care of the family also while getting the treatment of the patient. So suppose on the day one when I am counseling the patient, definitely I will tell them what is the side effect and how to keep yourself self motivated. You don't have to be tabooed like I have diagnosed with cancer, my life is hell, I'm going to die. Not like this. If the patient cannot bear that mental stress, we have our friends in psychology also or psychiatric also. We actually have the wellness center also. We can send them get it psychology counseling so that they get rid of this thinking. Or don't like sometimes it happen. Suppose in your room you have now came to know that oh that person came to diagnosis with cancer, and there is social like badness of these patients and the family, oh they have been diagnosed with cancer. So this type of taboo should be eliminated from our mind. This cancer is nothing, it is a chronic disease. Suppose patient diagnosed with the diabetes mellitus, diabetes sugar
Excuse
patient
me,
has.
sir.
Yes.
As you talked about the mental stress which goes on the family and the patient itself, in India, especially in India, psychologists and psychotherapy is considered a taboo, and it isn't, very initiated by the family members or the society to go to a psychotherapist or a psychology manager. So, what would you suggest? How can we overcome that, and how can we explain to others why do we need a psychotherapist in our lives, and why is it so important to let our inside feelings out to someone who like a third party, basically?
Yeah. See, first of all, I told you the treatment is long. So suppose treatment is suppose 8 months. So by these 8 months, this patient and her family have to visit us multiple times. So definitely this diagnosis of cancer, when that only not shock the patient, that also shock the family also. First we will do some routine advice like keep the meditation program, get the yoga, take the well balanced food. High protein diet is very important while maintaining on the any therapy like radiation therapy, surgery or systemic therapy. So if this worked out is very good. If the patient cannot bear that, then what is the we have to continue the therapy, right? So then we have to go to the next session like psychological counseling, and definitely we will counsel the patient and the family, and we will go get attached with the psychological counselor, so get self motivated or motivated from the family also. Because not only outside person also every time counsel the patient, family members have to counsel the patient also that you are okay, you are not with that, this is just a chronic disease, you will get relieved with very soon. Like that motivation is important from the family part also. And cost, regarding cost I can tell you, we have the patient assistance program, that is called PAP program. When you are administering very costly immunotherapy or targeted therapy, as you told, we have the patient assistance program. Suppose one dose has been given and another dose we give free of cost from the company, because these molecules are actually managed by the multinational and international clinical trial and mainly developed by the America. So until the patent is exhausted, the our Indian company cannot produce the biosimilar of lower cost of that immunotherapy target therapy.
Okay, we'll move on to the next question. Ritika?
Yes, sir. So my question was, when cervical cancer comes back, are there any distinct challenges, and what are the new treatments that are being explored for the recurrent cases?
Yes, recurrent cases, as I told, that there are new modality of therapy. Suppose recurrent case occurred in very small part of the body, then that can be addressed by the surgery. Then definitely we have to discuss with our surgical colleague whether that can be removed completely. Or suppose it is inoperable, then we have to think about the systemic therapy. Like as it told, the new modern of therapy, it is very effective in recurrent cases and metastatic cases or stage 4 cases. That is immunotherapy and targeted therapy. There is a new addition to the chemotherapy or systemic therapy.
Okay, thank you, sir. Riva has another question. So, Riva, go ahead.
Right. I also wanted to ask, in the case of someone who has had a male to female transsexual surgery, is it possible that it increases the chances of getting cervical cancer?
Sorry, I couldn't. Can you repeat the question?
Right. In case of someone who has had male to female transsexual surgery, is it possible that it increases their chances of getting cervical cancer?
Transsexual surgery?
Yes, sir.
No. Transsexual surgery has nothing to do. See, mainly the abnormal sexual behavior, like in USA or in where the westernized country, where there is a homosexual persons are there. When there is a homosexual person with the recipient or the donor part, they have the high chance of HPV virus infection, and they are more prone to develop the anal cancer. That's why I told this HPV virus is notorious for the male to develop the penile cancer, anal cancer also, apart from the cervical and oropharyngeal cancer. So this type of surgery is nothing to do with this development of the cancer.
Okay, thank you, sir.
Yeah.
Thank you all for joining today's webinar. Your engagement and insightful questions have made this session truly enriching. Thank you so much, Dr. Sanchayan, for enriching with your knowledge.
Yeah, thank you very much for your patient hearing. If you have any question, you can just WhatsApp me or email me. I will be happy to answer that. Okay. So, good night and happy New Year in advance.
Good night, sir.
Okay.
Happy New Year.
Bye. Bye.
Bye.